Welcome back. I'm Clover Frederick, your host for Shape of the City. Today we're going to be talking about breastfeeding, which is an important topic to talk about when we're talking about the health of our community. I'm joined by Ann Seacrest, founder of MilkWorks, and Dr. Kay Anderson, who's with the Lincoln Pediatric Group. We're going to be talking about the Lincoln Community Breastfeeding Initiative. Ann, can you tell us a little bit more about the initiative?
The initiative is a coalition of both Lincoln hospitals, Lincoln physicians, Lincoln medical offices, OB, family practice, and pediatric providers, lactation consultants, WIC, and other community groups such as MilkWorks and La Leche League. And its goal is to provide a supportive community environment for breastfeeding mothers in Lincoln.
Great. Now tell me why this group started.
Well, numerous public health and medical experts and organizations have really identified low breastfeeding rates as a major factor in the health of our country as well as our communities. And one of the messages that we kept hearing from women is that they heard different messages across the community, different messages from different providers, and they really didn't understand how to access help and how to access care from one step to the next. And that there was a lack of continuity of care between providers, and so we decided we needed to fix this.
Okay. Now, Dr. Anderson, you're a breastfeeding medicine specialist and a physician, so tell us more about how physicians have been involved in breastfeeding over the years.
Many years ago, breastfeeding support came mostly from grandmothers. Mothers would help their mothers breastfeed their babies, and breastfeeding was not really a medical issue. So therefore, breastfeeding was not part of the medical education curriculum. So now that mothers know that breastfeeding is best for their babies, they are unable to turn to their mothers for help because they didn't breastfeed themselves. So they're turning to their medical providers. Now, because this hasn't been part of the medical curriculum, perhaps the advice that they're getting isn't consistent amongst the different providers. So this group has come together to try to get those messages more clear and also help educate our providers. Most physicians, I would say all physicians out there, really want to help mothers breastfeed, but since they don't have that educational background, they don't know how to give the advice that most mothers need. So therefore, we want to get people together to do that better.
Okay. So far, how has this initiative been helping?
Well, it's kind of fun. We've looked across the whole spectrum of what happens to moms as they go through the childbirth experience. So we've looked at how can prenatal care providers work with moms, and we've tried to provide them with some messages and some tools that they can help. So we've asked OB providers to have a discussion with moms, to let moms know where they might get support. Both of our Lincoln hospitals have developed a shared hospital policy, so that when a mom goes to one hospital or the other hospital, she's going to kind of hear the same thing about breastfeeding. The policies are going to kind of be the same. We've developed similar curriculum for providers in town that teach about breastfeeding, for lactation consultants that help moms afterwards. So we've tried to just kind of create this consistent message and this system that kind of links together. We're also educating providers on best practices. One of the things that we are really highly encouraging is what's called skin-to-skin care after a baby is born. We know that when a baby spends time on its mother's chest right after birth, for up to about an hour, that this improves the breastfeeding outcome.
Great. What kind of difference do you hope to make in the community?
I would say that overall, we would like breastfeeding to be the norm. So when mothers are pregnant, they learn that breastfeeding is the expected thing that they will do. Now, for some mothers, in the end, it may not work out, but hopefully they will, most of them at least give it a try. And I think previously the norm has been to feed formula, but I think the tide is shifting over to breastfeeding, and we want to be able to help those mothers do that more successfully.
Great. Now, outside of medical professionals and lactation consultants, how can the community come together to encourage mothers who are breastfeeding their babies?
There have been some really exciting things that have happened in the past couple of years. Nebraska became one of the last 2 states, due to Senator Annette Dubas to actually pass legislation that really allows mothers the right to breastfeed in a public setting. Wherever they have a legal right to be, they have a legal right to breastfeed their baby. The Affordable Care Act also amended the Fair Labor Standards Act. So employers now need to provide private space as well as breaks for a mother of an infant under a year old to pump while she's back at work. I think there's a whole shift in the community. I really do. I think we see it in that moms are seeing more that this is something that they want to do for their babies. Now, how can they access the support system since we interrupted that family support system? And we have not been a breastfeeding culture. It's hard to grow up and know how to breastfeed your baby when you don't see it around you. So we're just trying to make that subtle shift to make the whole community be different, including families, friends, co-workers, the work environment, restaurants, public restaurants, in other words, wherever moms are going to be.
Okay. Any words of advice we could give grandparents who perhaps didn't grow up seeing breastfeeding and now they have a new grandbaby and the grandbaby's being breastfed? Any advice for them?
Grandparents are a tremendous support system for young mothers, and I think if they can see that breastfeeding is becoming the norm, even if they didn't do it themselves, they can support the fathers, help take care of the other siblings perhaps, so that the mother can have the time to breastfeed her baby and get the sleep that she needs and help provide meals and those sorts of things. I think it's also important that we realize the tremendous health benefits, not only for the babies with breastfeeding, but we have to remember there's tremendous health benefits for the mothers also. This grant that we got for Partnership for a Healthier Lincoln, mothers who breastfeed, it helps with rates of obesity for mothers, decreases the incidence of diabetes and heart disease and hypertension.
Well, those are some great benefits for a mom. Now, tell me a little bit more about the benefits that baby will receive.
Well, you know, there's a lot of stories circulating around about what breastfeeding actually does for a baby, and I always like to look at the 2007 meta-analysis that was done of about 9,000 research studies. And that's what we turn to when we look at research-based information on this. And what we know is that when babies are breastfed, particularly if they're exclusively breastfed for 6 months, with breastfeeding to continue for about 12 months, which is what the recommendation is, that what we start to see is we see a decreased lifetime risk of obesity, as well as type 1, type 2 diabetes for babies. We also see fewer acute infections, respiratory infections, ear infections. We also see less asthma and less other atopic diseases that come along with it. So overall, it really widely impacts a baby's health. We're also seeing more and more research emerging on the benefits of the actual process of breastfeeding. In other words, the process of a baby being at the breast, and what this does to kind of organize, mature, and socially develop an infant, because they are part of human beings.
So what information is out there for community members who might want to learn more about this initiative?
HealthyLincoln.org has a link to the Lincoln Community Breastfeeding Initiative information, and on there we have educational tools for prenatal providers and for moms, for support groups after they deliver their baby, and places that they can seek help with breastfeeding. And we hope to add more tools to further educate the public and even physicians to help support mothers breastfeed their baby.
Our whole community benefits when we come together as a community to not only provide mothers and fathers with the type of information they need, but also with this support system that they need. It's a real win-win for all of us in terms of healthcare costs and increased health and well-being for all of our community members.
Okay, very good. I feel like the moral of the story is that there are now a lot of places for women to go to get a consistent message about breastfeeding. So thank you both for joining us. When we get back, we're going to show you some exercises and things you can do in the workplace to break up your day a little bit.